Hi, welcome everybody, and thanks for being a part of this. Dr. Bhanu, I'm very, very happy to have you here.
Thank you so much, Dr. Priti. Thank you so much for having me here.
Thank you. And you know why I wanted to do this session with you is whenever we prescribe CBD oil to our patients, they have a lot of questions, and the first response they give is, do you have any other option available?
Yeah, this is something which we really need to change the mindset of the people, and mindset can only be, incorporated once there is more of awareness. People need to understand this is a herb, and not a single substance in this universe is there which has no medicinal properties. In fact, we eat chapati or drink water also in a wrong manner, then they can also create a lot of side effects into our body. Then this is a something which has been medicinal, part of prescription of doctors over the years. And I mean, people need to be a little more aware, maybe via us, maybe because of the healthcare professional has to bring a lot of effort to bring that awareness. And they actually have to teach the people that you have to unlearn many things that they have learned over the years. The preconceived notion has to be removed. So,
Perfect. So,
option की तो कोई बात ही नहीं है.
why,
So, what exactly? Yeah.
why do you say that people should take CBD oil?
Actually, see, this is a herb and it has more than 160 active compounds into it. They are known as cannabinoids, right? So now people have, over the years, they have actually associated this cannabis or the CBD oil with this thing like euphoria or the high feeling, right? So this is something which they knew about it. But the fact is not this. It has more than hundreds of the cannabinoids which work and has a lot of therapeutic benefits. So it is a THC which has intoxicating effect which can give you that high, right? But then you have another compound, another cannabinoid which is known as CBD, which has many medicinal properties into it. And in fact, when we talk about the THC also, yeah, in a higher quantity and in a larger dosage it has that euphoria or the high creating impact. But then again, it also has its beneficial properties. The therapeutic properties are there, like THC will bring you the onset of the sleep. THC will help you. It has anti-nausea properties, anti-spastic properties. So that is why we always say awareness is much important. It has a lot of beneficial properties also. Together they work in a synergistic manner to bring benefits, right?
So, if you can elaborate the indications for CBD, then for
Yeah.
THC, and then combination.
Yeah, so CBD basically has a lot of therapeutic benefits that I have already mentioned. One is it is antioxidant. Second, it is anti-anxiety, which actually people are really battling. Again, that's a painkiller, will help you in maintaining the sleep. And we know sleep, if you're not sleeping properly, I mean, you're inviting a lot of diseases into your system. That is all about the CBD. But when we talk about THC, in trace, when you take it, especially when in the form of the medicine, then it is anti-nauseatic, it is anti-spastic, and of course it improves the onset of the sleep.
Right. What are the side effects people can experience with plain CBD or CBD and THC together?
See, actually, I don't see it as a side effect. Whenever you incorporate or you start with some kind of medicine, it will definitely, it is meant to bring some kind of change into your body, right? If we, I mean, I always give an example to my patient. When you just, try to arrange your wardrobe, at one point of time, you will find it more chaotic, more unorganized, but then slightly and gradually it will bring, and it will become a clear and a clutter free wardrobe, right? So when we talk about this, initially people might feel little drowsiness, people might feel a little bit of dryness in their throat. This is all what generally we see. And at times we see that the people say that yes, we little bit of the palpitation could experience it, but this is something which is very rare. The majorly which people actually come back to us is that we feel a little bit of drowsiness when they started off. So this is something which they experience, but after, when they continue with the medicine, after 5 or 7 days it just pass away. So that's a temporary thing to happen.
Great. So, Dr. Bhanu, are there any patients, anything in patient's history which tells you that this patient should not be given CBD or THC combination?
Yeah, definitely. This is something which a healthcare professional, and in fact, the patient should also take care of this. One, the schizophrenia patients, right? They shouldn't. Maybe they are not the schizophrenic, but then if they it runs in the family history. One. Second thing is that it is not about that the patient who all are heart patients, it is contraindicated for them. But yes, if they have, they should really notify this to the doctor so that the dosage could be advised in that particular manner.
Right. Any other things in history? Any other thing, any other type of patients who should stay away from this?
I think generally the heart patient should be careful about it, and to schizophrenic, it's a big no.
Right. When you say heart patients, can you elaborate a little?
Yeah, that's the coronary, and especially when the people are there with the pacemakers.
Great.
And also the people, because this particular herb has a tendency of lowering down the blood pressures. So people who have a tendency of a very low blood pressure, they should notify this to the doctor. I'm not saying it's a big no for them, but
No,
yes, they should
no, you
notify.
have
That's
to.
why yeah, please tell me.
No, I said you have to be careful in these patients, and I was really wanting to
That's
hear.
perfectly, because that's why we always say it has to. I mean, I always say to my patient, what do you mean by over the counter medicine? Everything should be consumed under the supervision of a doctor. Anything, what I mean, see, in fact, we talk about the neem also. We talk about the moringa also. They all are antioxidant, and in itself, they are medicinal properties. But what is right for you? What is right? What is the correct indication where you have to stop it? This is only the doctor who is, better going to judge and explain it for you. So now, when it comes to the cannabis, also, it is absolutely safe. There are few contraindications, but then if you notify, what is the harm in taking or starting any medicine in the supervision of physician?
Right. So, Dr. Bhanu, in last few years, cannabis has really come on the prescription of doctor. Right. In India, this is something which was used many, many, many years back, and we have a huge history of benefiting from this. Yeah. I want to know your opinion on some very basic conditions where this is pretty effective. First is sleep.
That's my favorite topic. Because
Oh,
yeah, because in Ayurveda we always say that the sleep is the one pillar, major pillar. How important the diet is to you, it is equal. I mean, it's a second diet for your mind and your soul. It renews you, right? So at times what happens is when we start prescribing the medication to the people in terms of pain, in terms of migraine, for the dysmenorrhea, we always see that the pain, the anxiety, and whatever the other ailments for which we are prescribing, ultimately that problem is debilitating, or it is disturbing their sleep. And when you are not able to sleep properly, in it is actually bi-directional. If you're not able to sleep properly, you will experience more of pain, and because of the pain, if you are not sleeping, I mean, at the end of the day, both of them are bi-directional. So what I see is that when people sleep well, especially the cancer patients are able to sleep well, the anxiety people are able to sleep well, so the healing goes faster. So in terms of sleep and in terms of anxiety, it is definitely helping people in a very good manner. And when always treat my Parkinson's patient, a lot of stiffness is there in the body, and then they say to me, मैम मैं एक दिन क्या मैं आराम से सो सकती हूँ. That's what people say to us
Right.
because the stiffness and the rigidity that they have in the body. If we are able to help those people out, if they are able to sleep proper, I think my bit of part is done.
Right. So, which stage or phase of sleep does this work on?
Actually, majorly, sleep is, we have, broken it down it into the various stages. But yes, it is actually working on the entire sleep architecture. We have seen that's majorly the third stage, that the deep sleep stage. It is really working well. And once you have that stage done, I mean, you wake up very restful because the major part why you need a sleep, because your body repairs yourself, it heals yourself, actually it renews you, right? So that part is done in the stage 3, the delta waves. When you meditate, what happens? The delta waves are, so basically the entire renew, the need of the sleep is attained by getting that third stage of sleep. So it is working there.
Right. And what is the dose which you generally see very effective in people who are not
uh,
able to?
this is a tricky question because every individual is different. I
Right.
may be, I may be happy with one chapati, but I mean, you may require two chapatis. So
Mm.
I mean, so I, for that, I always say every individual is different. The individual may have, uh, you know, could have various kind of diseases, various kind of ailments, various kind of symptoms associated with them. So according to that, we assess properly, we take proper history of the patient, and then we decide the dose. If you are into the pain and anxiety, then of course you may require some other dose. But if you're not able to sleep properly because of the PTSD, the nightmares that you have, in that case you require some other dosage. So that's why it's not an over the counter, and you need a physician always. So the dosage will always be decided by us. But yes, we always say the titration is the key here. We start with the lower dosage, and then we actually ask people uh,
Start
to,
low, go slow.
yes, it's not a marathon run. That's what we say.
So
It's
I
not a
just
marathon
people
run.
start
Slow.
low and go slow. Let your body adjust,
Yeah,
right? And because once you start at certain dose and you have side effects, your confidence in the new therapy goes down.
correct. Correct.
But when you start low and go slow, slowly and gradually your body adapts, you see minor changes, your confidence improves, and hence the result you get also improves.
Absolutely. Absolutely. This is something, and post COVID era, what we have learned, I think, don't, I mean, stop quick fixing the things, address the root cause,
Thank you for
because we will
saying
reach nowhere. That's why when people take the popping pills and sleeping pills they're taking, at one point of time they always come back to us and then they say, no, it's not working for me now. I think I have to increase the dose, or maybe the same doses work. I mean, I'm only able to sleep for 2 or 3 hours. So the quick fixes has to stop somewhere, and the people really need to understand this. This way they are not going to reach anywhere.
Dr. Bhanu, fibromyalgia.
Hmm.
Lot of people have fibromyalgia.
Yes.
What is your take of use of cannabis in fibromyalgia cases?
It has a tremendous improvement because fibromyalgia is something, from my perspective, how the number of the patients I see, it is not just the physical but the mental aspect also. It is contributing to them. So basically it is helping those people in getting out of it. But then again, people have to be patient, and it really, because it is the compounds present into it works on the inflammation that's constantly going into their bodies.
So, in how long do you see good results in fibromyalgia cases? And what is generally, what you have in your experience seen, कितनी देर
Sorry.
तक आपको ज़रूरत पड़ता है?
Uh, it wasn't much clear. The question wasn't much clear to me. Maybe
Duration of
because, but
treatment to be
you're
beneficial.
asking me the length of the treatment the one has to take it. Yeah. All right. So again, um, you have to start taking the medication, and gradually people start seeing some kind of improvement based on how chronic the ailment is. Then we generally see people tend to see some kind of improvement, let's say in the uh, 15 days or 20 days of span. You don't expect something, overnight, no, but yes. And then gradually the medicine will go into the system and will start working on the inflammation, the pain part of the body. And then gradually we start tapering off their whatever the medications they are on. So assessing how the medicine is working on the system, assessing how the patient is showing us the improvement. Then, the patient has to be regular at least for 3 months. But then again, the chronicity of the ailment that one has to, and how the patient is responding to the treatment, that will decide the length of the treatment. But yes, we do ask patient to give a gap for the tolerance, cannabis to break the tolerance of the medicine.
Can you elaborate a little more on this?
The tolerance part.
Yes.
Yeah, see, whenever patient take the medicine, of course, at one point of the time, people can actually, feel like you, okay, I'm becoming dependent, or the medicine is not working on me. So at that point of time, we always ask people to give a gap or a break of 3 or 7 days, and then we start it again.
Okay. And so generally the patients, they're scared of taking this because they say it is addictive and they will have to be on this for life.
So, of course, there are a lot of researchers which says that it is less, addictive. Even to caffeine, also is less addictive than nicotine, opioids, and alcohol. But I always ask people, uh, it is less addictive than your mobile phones.
Right.
So
But
it
then
is,
mobile
yeah.
phones are very,
So
very
nothing.
addictive.
In fact, the researchers hasn't shown this that it is addictive.
So then supposing a fibromyalgia patient feels better in about 3 or 6 months,
Hmm.
is the patient able to stop the medicine completely?
Uh, yes and no both.
And while so,
See, what exactly is the cause? If you are adhering, because it's all about the holistic way of treating the patient. It is the diet which contributes to it. It's the ongoing inflammation. It is the ongoing mental health. If you are just able to break that entire thing via the lifestyle modification, then we can actually help the patient coming out of the medicine. But if it is ongoing thing is going on, people are not following what we are actually asking or suggesting them, then they can have to go on some kind of maintenance dosage.
and can you suggest what generally maintenance dose?
Sorry.
Maintenance dose. Can you give a little more details on how do you plan maintenance dose and how does your chart look like for how long?
So generally, what we ask, we take the entire history, and we actually assess the patient and whatever the medication the patient is on, and what are the comorbidities the patient has. So according to that, we decide the dosage for the patient. We start with the minimum dosage, and then we take it, and we ask the patient to increase. I mean, the titration we always ask the patient, and then we check what diet, what is the sleeping pattern, what are the diet they are taking, and this is how we take the treatment forward. And of course, we ask the people to follow strict follow-ups. It's not like that, today you start a medication and then you go on with the medication. This doesn't happen. And this shouldn't be done also. Maybe that's whether the patient is taking medicine from a dietitian, maybe any kind of the treatment they are taking. But this should strictly, patient should understand this. Like, see, when you are repairing a wall, I explain it to my patients like this: when you are repairing a wall and some kind of deposition is there, you will just scrape it out. right? But if you keep on scraping it out, at one point of time, you will end up making a hole there. The overcorrection happens. So you have to understand somewhere the medicine has to be, has to be stopped one, and somewhere you have to go on a maintenance doses also, because there are diseases which are curable, but then there are diseases where you have to maintain with the same medicine.
Perfect. Dr. Bhanu, anything you will want to share with the audience? Anything about cannabis which can increase their confidence to use it on their own self or with their patients?
So one thing, that, see, it is not only just that the sleep it is helping you out. People generally think a lot has been, people are actually taking this medicine for the depression, anxiety. It is tremendously helping them out. But there are other areas also wherein it is very, very effective. Like, uh, see, when we talk about a good sleep, it is actually helping you out. So think about it. If you're sleeping well, the ongoing inflammation, you are able to break it, right? It is very effective in the terms of the migraine. It is very effective in managing the complications of the diabetes, like neuropathy, right? Then we talk about the obesity. It's a, when people take this medication, people say our appetite has gone on a very higher scale, so it will put on my weight. But this is where the major role of a doctor and the awareness and the understanding of this beautiful herbs come into the picture. The same medicine has the other active compounds into it, which will just improve the feeding behavior of the patient. And we have seen that the ongoing inflammation once comes down, the in diabetes is not only about the 120 mg per dl which is showing in your blood reports. It's actually the obesity, it is the poor sleep you have, the ongoing inflammation, everything is contributing to it. So it is actually working on the root cause. And this has been seen a lot in the, I mean, there was a research done on the rodents, I mean the mice, it was done, and then it was seen that it really works there well. The obese rats were actually able to shed off the weight. So if your appetite is going on high, I mean, don't worry about it, because the other compounds will take care of the the waist circumference that you have, and then it works very good on your appetite. Think about the people, I mean, who are not able to eat properly. Appetite is something which people says, so what if you're not eating properly? But think about the people who are on the dining tables and they're not able to eat anything. They feel nauseated because of their mental health. Think about the people who are cancer patients and they're not even able to complete their treatments. It's not just the managing of the pain by the cannabis medicine, but I have seen people dying of hunger when they are into the cancer. I do remember one of my patients who took the discharge from Safdarjung Hospital, and straight she came into my clinic and she said, the doctors are, she was at the third stage of cancer. She was in the third stage of the ovarian cancer. And then she came to me and she said, Ki, I want to eat roti, Dr. Bhanu. And I really, I mean, I wish I could knew about this medicine prior, so I could have, I mean, would have helped her out. Think about the people who are battling with the irritable bowel syndrome, because they are not able to, they are not able to socialize, they are not able to, or the professional and the personal, everything is hitting them. So there are the various areas, and when your mental health is not doing well, it is actually deteriorating everything, your gut health, your joint pain, unexplained pains that you have in your body. Think about the endometriosis. I mean, this medicine has the ability to work on various places, but you have to I mean, people have to understand this. It is not cure for everything, but it does work at various
It does
areas.
support in reversing lot of conditions. And in my practice, I have seen this as a very, very, very good adjuvant therapy to whatever else I'm doing on the root cause base.
Yeah,
Yeah,
of course.
great.
The anti-nausea properties, people are not eating properly. I mean, the pain that they have, their caregivers are not able to sleep for days and days.
In postmenopausal women, sleep is a big problem. I see this playing a very, very important role.
Not just this, but the postmenopausal depression. I
Yeah.
think it is a boom. I mean, it's a blessing for them.
Perfect. So what you're trying to say, Dr. Bhanu, is more and more people should use it. I have used it myself, and I can say that yes, if used properly, it is pretty good addition to our whole things which we use in functional medicine.
Yeah, correct. So what I'm trying to say is whatever you have learned and whatever the patients and the users have the preconceived notions, I mean, they should actually unlearn all those things, and we are there to educate them, and we are there to help them out. I mean, and when we talk about what actually the patient should look into it, the one thing which is very important thing is they should, when they think of just buying or starting a treatment, they should look at the brand. And one thing which should they should actually look into it is the ingredients. One thing that they should actually look into it is that the third party label, right? Because they will check the ingredients, they will check the contamination part, they will check the potency part. And one important thing which I always ask my patient is whatever is visible everywhere doesn't suggest that it is good. So look for the best brand.
Right. So, Dr. Bhanu, there is a question. Can we know more about specific details regarding insomnia?
Sorry.
Regarding insomnia,
Uh, I mean the medicine, or I mean the question isn't much clear to me.
can we know more about specific details regarding insomnia?
Yeah, so when we talk about the insomnia, inability to sleep, one, right? And I mean, my understanding to this is it is a symptom of so in itself it's a disease, but then again it is a symptom of so many. You're not able to sleep because of the various underlying causes. And third thing is it is self-created problem, the casual behavior that we have. So what if we are sleeping 12 in the night? So what if we are getting up 9 in the morning? And this actually, when this casual behavior goes on, and then you end up with the problems like insomnia. So not just the latency, I mean, you're not able to sleep properly, but if you're waking several times in the night, then also you're the disturbed sleep, the kachi need, which we call it as, that's all about the insomnia.
And Solomon, you can connect with me later if you have any more questions. Thank you, Dr. Bhanu, for being here. And if we get any questions, we will be in touch with you.
Sure. Thank you so much, Dr. Preeti.
Thank you. Thank you.